Hello. Today I will be giving an informative speech on a disease called attention deficit hyperactive disorder. If you don't know what it is defined as a disorder of learning and behavioral problems characterized by marked inattention, distractibility, impulsiveness, and hyperactivity. 2% of the U.S. population is diagnosed a year, and it is very common in young children. It is also said that 1 or 2 children in a classroom of 30 are most likely to have attention deficit hyperactive disorder, also called ADHD. To know how to diagnose someone with ADHD, first you must know the symptoms. The symptoms must occur in more than one social setting and occur often in order to be considered repetitive enough for the disorder. Symptoms of inattention include making careless mistakes, lack of attention, poor listener, poor organization, fails to follow through, loses things easily, distracted often. Symptoms of hyperactivity include fidgeting or constant movement, always needing to be on the go, a tendency to be talkative no matter what the social setting, and difficulty with quiet activities. Symptoms of impulsivity include blurting out or interrupting, being intrusive, not able to wait, or extremely impatient overall. Ways to have a child diagnosed are to take them first to your family doctor. If they think that your child needs to be evaluated by a psychiatrist or behavior therapist in order to further understand the behavior tendencies and diagnose it as ADHD, then you must do so. Otherwise, it is also safe to have teachers do a day-to-day evaluation and write notes on how the child behaves daily. The origin of the disorder is unknown, but it can sometimes be related to genetics. There is no cure for the disease, although it is very easily treated. The forms of treatment include pills to be the most commonly used. Stimulant drugs, including Adderall or Ritalin, are commonly and most popularly used. They reduce the symptoms, help with getting distracted and not being able to stay focused. They allow for you to finish tasks and calm the hyperactiveness, but there are negative side effects to these drugs. Sometimes these drugs can lead to other problems such as depression or anxiety, also a change in appetite leading to poor diet. Other treatments that don't involve the use of drugs would be going to behavioral therapy or working one-on-one with the child to help quit the bad habits and allow them to stay focused during their tasks. Personally, why I think it is important to be informed about this is because I myself have grown up having ADHD. I was diagnosed at a very young age, and ever since then have been on some form of stimulant to allow for me to not have the symptoms. The drugs have helped me greatly, although nowadays I see this being diagnosed way too often. Just because a child is hyperactive does not mean that they have ADHD. I think that more tests need to be done before diagnosing a child and immediately putting them on a form of drugs. I also think drugs should not be used unless the child needs it in a day-to-day life. I hope you learned a lot from this speech and are now informed enough to be able to use this information in your daily lives. Thank you for your time.